couple people knows that I have a lot of anxiety being here. So I need to talk about patient navigator and community health workers. And then the objective is increase the availability of patient navigation and community health workers service along the cancer care continuum. Patient navigators and community health workers, they have a big role on cancer patients. There are those people who are there since the beginning when they screen patients for cancer onto probably the end of the life of the patients, with them and with the family all the time. And their role is to reduce the barriers for those who suffer of cancer. So we are there to try to promote screenings, be there for when the patient is diagnosed with cancer, diagnostic treatment, and I'm trying to just hear what everybody's saying today, and I can say, because I'm the last one, that everything makes sense with patient navigators. So somebody talked today about genetic counselors. The majority of my patients, they cannot pay genetic tests. We need to find out the way to get that money for paying those tests for the patients. So somebody talked today about other cancer and chemotherapy drugs affect the patients. They need to go to the dentist. Some of the patients, they cannot afford that. So patient navigators are there to try to engage the community and get those resources together and help the patient. Financial barriers is one of the most common one. Healthcare system is probably the biggest ones. The patients, the majority of them, they don't even know what they do. They have Medicaid. They don't even know what that covers, what that doesn't cover. If they don't have Medicaid, Medicare is worst for them. Survivor health, when they talking about survivor health, I was thinking our patient get the service of healing touch. It's awesome for them. They feel relaxed, they reduce their stress, they bring their caregivers with them, and it's awesome for them. So for me, everything makes sense. When they talk about today about survivorship care plan, majority of the patient navigators help with that too, with the patients. Healthcare system is still complicated, no matter if you have insurance or if you don't have nothing. For me, it's complicated. And I don't want to tell my story, but I gotta start crying. But we hear the story of, what's her name? Let me go back. Stacy. So Stacy is one of ton of story that we cross every single day. She really has a great support. Can you imagine Stacy's story with no support at all? And this is kind of patient that we have here every single day. So patient that they don't know their language, they don't speak English, they speak Vietnamese, Spanish, Korean, Chinese. There's no way to trying to communicate. So when patient navigator and community health workers are there, they help and engage everything. So I see patient navigation, so we have a ton of slides here, and I am out from there. But I see patient navigation and community health workers and all this stuff, everybody here, that we are a huge We need to build a huge bridge between patients, between community health workers, patient navigators, physicians, hospitals, community, and the Colorado Cancer Coalition. We need to, all of us, work together to try to help those patients in need of help. And like I said, no matter if you have insurance, when you don't have health, everything is devastated. And you need somebody else next to you. And then here in Colorado, we have the Colorado, we have a patient navigator training that help those people who want to get the training to try to help those patients, and community health workers. So we have a great opportunity here that they get trained and they get the same service in every single hospital. And a couple of the hospitals here in Colorado that I know, we have some kind of way to measure, but we need to do better. That's why we need you guys, because we need to find a way that the service that we deliver to the patient, we need to measure that. I work as a health education specialist at the health, and patient navigators make a big, huge difference. It's not the same thing when you have a physician without that kind of help. I work with a doctor every Wednesday, and then my role is like a patient navigator too. So we make a huge difference. I believe in that 100%. They make a huge difference in my life when my son get diagnosed with epilepsy. It's not cancer, but it's devastating. So I encourage the Colorado Cancer Coalition to help us to get off the goals. And then we can help you guys to make their life of the cancer patient better to the end of life. And I think this is all. Any question?
So I'm cheating, Elizabeth. This isn't a question, but I just wanted to recognize Elizabeth won a national award through the American Cancer Society earlier this year for the quality of her work with patients. It's pretty remarkable, so I'd like to recognize her.
Thank you. Any other question?
This might be kind of an obvious question, but I was wondering, what is the number one thing that you would want the advocacy groups that are present here to work on to support you? Because, for example, we know that we need to develop more services, and so I'm just curious if you had a priority from us, from the advocates in the room.
I think we need to have all the navigators together and then get them the same training that we offer here, and it's completely free in Colorado for those who wants that. And number two, we need the same measure, a data measure on different hospitals. And we really need some navigators, patient navigators in different hospitals, different settings. So I know a couple of hospitals, they don't have some, and we do need that. So where I work, we work with all types of cancer. There are some places that they are specific to a grant for breast cancer or cervical cancer. So for me, we need those for every type of cancer. And then we work with not only the cancer, with the chronic disease of the patient. If they have diabetes, we work with them, we encourage them to walk. I walk with them, so we do different stuff. So I think we can elaborate a real good program, and then trying to have the same program, I know can be difficult, but not impossible in every different hospital.
would you identify as your biggest barrier to patient care, and how have you overcome that?
So right now is healthcare. We know that on healthcare we have Medicaid now, so we think with the Medicaid we solve all the problems, and it's not the reality. So we have in the middle of everything some patients that they don't qualify for Medicaid, and they are out of the range because they have to be on the 133. So we, those that is 250, they are still on poverty, but they don't qualify for some services. I think this is the big challenge. There's people who work hard and they don't qualify for services that they should qualify because they make a little bit more. Just a little bit more, probably $50 more, $100 more. And they have to pay copays, high copays, and for some of them, they don't go to the doctor, they don't do the screenings because they don't have the money to just do it. I think this is the biggest one, besides, well, we have a ton of people that they don't qualify for Medicaid, and we know here in Colorado. Those other one is really challenging. And then when they come in, they come in supposed for screening, but they came too late. The cancer is already spread because they came with symptoms, they come in with symptoms. So I think this is the biggest challenge here. Any other question?
I just wanted to share an observation. As when I came here today, I really was not aware of sort of the larger purpose of this meeting, and other than sharing the new plan, I didn't realize the sort of the aspect of advocating for prioritization and making your case. And as I listened to it, and so many of these areas are focused on addressing issues of health equity, and which is fantastic. This particular issue of the patient navigator, to me, seems, I mean, there's a reason it's in the cross-cutting section of the plan. And it seems to me like no matter what else you prioritize, this one can amplify the impact of any of those other areas. Without this, the impact seems more limited. And so it just strikes me that, as you said, you heard aspects of it in everything you listened to today, and I think the added value, the bang for the buck, so to speak, is really there with patient navigation.
Thank you. Other question? Any other?
Thank you for everything that you shared with us today. I just had a question about what happens to survivors in terms of patient navigators and loss to follow-up and things like that. Because I would imagine that if somebody has somebody advocating for them while they're going through the process, and then once they become a survivor, they may not have as much support. So I was just wondering if you could speak on that topic.
Wait. I cannot talk about other patient navigators. I can talk about based on my experience. So my survivor follow me. So they still in contact with us. The family, the children's. So I think if we prepare really good the patient navigators, we're not gonna have that huge loss of follow-up patients. The patient trusts navigators because the navigator has more time to talk to them, more time to engage with them. And then we are on the middle of everything that we can go back to the doctor and say, your patient, they don't have transportation, or your patient has problem with the kids, or they lose the housing, or they become homeless. So there are some times that the physician, if probably we have a couple of physicians here, they don't have the time to talk about everything. They concentrate on their treatment, which should be like that. So we are this other bridge to help them with all that stuff. So we can reduce, I believe in we can reduce real good the no-show rates.
I'd like to expand on that a little bit. I think there's a real role for navigation and prevention, particularly in colon cancer prevention. Some of the biggest barriers, particularly for low income or Medicaid insured population, is no-show rates, inadequate prep rates, inadequate communication between the primary provider who's sending the patient and the subspecialist. I think that navigation is the key to many of those things. It's not only low reimbursement rates that are making it more difficult to get specialty services. There are some of these other issues that can really be addressed, I think, with navigation.
Yeah, it's true. And then I want to share some story. One of the story that we have with one of the patients that we missed in them, lost follow-up for screening, who needed diagnostic, need the biopsy. And then nobody just get and trying to find them, trying to find them, and then on the system, whatever they said, the phone number that they put on the system is the phone number that we have on the system. So it's lots of follow-up. And I was thinking, oh, that patient has kids. So let me go other route. And I say, they should have food stamp. So I went to the database of the state and find a good phone number and then get the patient back. So we are brainstorming about all this stuff to trying to find patients. Some patients, they owe so much money that they don't give the phone number to the hospital. But we have some way to find them and then tell them nice, to come back, If you want to be around for your kids, for your grandkids, you need to come in back for your screening. So.
I just wanted to add to what Elizabeth was saying in that the training and trying to standardize some of the navigation can help, because not only are we navigating, we're advocating, and we should be teaching and providing the resources for these patients to blossom on their own as well. We can't, hold their hand for every step, but I think that a crucial thing to remember with navigating is to provide the resources to empower these patients, and then you don't lose them to follow up. They know where they can call if they need to, but kind of just being that, strength and push as they move forward.
Thank you. And I can share what is my goal in the future is to get in Colorado that every patient with every type of cancer, any type of cancer, get treated for free. So we can in the future fight for that. There's New York, they can treat patients with,